Best practices for wound closure and dressing in knee and hip arthroplasty. A modified Delphi approach. Optimal recovery in total knee and total hip arthroplasty requires the best techniques, yet consensus on best practices remains limited. Are the most effective wound closure and dressing methods being used in joint restoration surgeries? To answer this question, an extensive literature search and review was conducted by a panel of 20 international surgeons. From this research, 40 statements were developed and refined via an iterative process, including peer review and voting. Consensus was reached on all statements with an established threshold of 75%. In total knee arthroplasty, consensus finds that fewer wound complications and faster closure times can be achieved with barbed sutures, mesh adhesives, antibacterial sutures, and silver-impregnated dressings. A semi-flexed position improves post-surgical range of motion, and for venous thromboembolic disease prophylaxis, aspirin was favored over other chemoprophylaxis methods. Barbed sutures are also recommended for total hip arthroplasty. Subcuticular sutures may help reduce the risk of superficial surgical site infections, and mesh adhesives contribute to lower wound complication rates. For both total knee and total hip arthroplasty, antibacterial sutures are likely to reduce the risk of surgical site infection. Overall, these findings establish a foundation for improving clinical practice, providing patients with an elevated standard of care in total knee and total hip arthroplasty, and guiding the direction for future research and improvements.